Today we're here discussing scoliosis.
I'm Alex Davis, one of the PAs with Summit Brain, Spine, and Orthopedics in Lehigh. Ben Jensen.
Physical therapist, Dry Creek Physical Therapy.
Yeah, and the thing that we share in common was the topic of the discussion today. We got to talk about scoliosis, and specifically the adolescent idiopathic scoliosis. So tell me your experience. How are you familiar with this topic?
Provider, you think you know everything. And my wife came to me one day, and second oldest, she said it looked a little curved, just didn't look right. And of course, as a provider, or as a dad, you're like, no, it's okay. I'm sure it's fine. And later that day, we went riding on bikes and saw my daughter hunched over the handlebars, and I saw the obvious rib hump, and I recognized, oh boy, this is something I brushed off. I should have looked at and started a course of us evaluating it. So.
Yeah, and then on my end, our oldest daughter is 12 years old, and she just needed her vaccine to go into junior high, so we set up an appointment with our pediatrician for a standard well child check to get her immunizations updated, and he did an excellent job, Dr. Mumford, and did a full physical and history and did his full well child check, and part of that is the Adams forward bend test that you're talking about and seeing the rib hump, and had enough concern that he sent us to go get the x-ray series, and sure enough, she's got about a 40-degree curve, which is always shocking, and it's twofold for you and I think, is as a parent, it's hard to see that your kid now has kind of a new identity and something that they're gonna have to deal with for a while, but then also as the healthcare provider, you feel like, I feel like I work in this world. I probably should have caught something like that. Did you have a similar experience?
100%, and it was a moment. Our daughter had fractured her left clavicle when she was about 9, a couple years before that we saw the scoliosis, and so she had always held her shoulder a little differently. So but 100% correct. It was a lot of, why did I not see this? And hers was really aggressive early on, and it was a moment of reflection for sure. Yeah. And nothing makes you, as a parent and also a provider, dig into the research than when you come across something that you should have seen, and now you see. And I don't know, how was it for you? I mean, all of a sudden you have this diagnosis. Did you all of a sudden just dive into it?
Oh, deep? For sure. Yeah. I was reading everything and anything I could find, and I feel like that's always a little bit shocking for then when you go see the specialist and the parent is very well informed. Yeah. And I think I always appreciate if a patient is coming to see me and they can at least notify me, I have some experience in this world, I work in medicine or whatever it may be. And it helps to have a more meaningful discussion when you can just get right down to the key details and figure out a good plan of care. Was your daughter having any symptoms?
She wasn't. She was just active, playing soccer, playing every sport, just going, and nothing, no limitation, no pain whatsoever.
And then any reflection afterwards, did you look back and notice any signs?
Honestly, it was just more the positional stuff. I think just looking how she kind of held her shoulders kind of differently. I think I'd always kind of thought, oh, that's her clavicle fracture, how she kind of held her positioning weird. But there's obvious signs. I mean, we can even look back in pictures and go, well, yeah, I should have saw that.
Yes. So we had the same thing. The first specialist asked my daughter if her back ever hurts. And she says, well, what do you mean? Like right here in this spot? And they're like, yes. She's like, well, yeah, that hurts sometimes.
Oh, there.
But had never said anything. She's like, I thought it was just normal. Like everybody has that.
Wow.
And kind of similar, we look back at old pictures and we're like, yeah, why did she used to stand that way?
Yeah.
Why did I never think to pick that up? So, it's out there in the population. It's fairly rare to have these significant curves, but we definitely see it out in the population. So just a word of advice to advocate and to screen and to do your preventative medicine. Mm-hmm. Tell me more about the outcome then after the diagnosis. What was the experience? What kind of experience did you have? What treatment options were presented, and what did you end up going with?
Yeah, so hers was pretty aggressive, 65 degrees, and that's initially they said 58 when they did the reading at the pediatrician. Went up to a specialist at Primary Children's, just a local hospital in Salt Lake region, and they have a spine specialist, and he was able to look at it right away, and they did a series of x-rays. They said her angle was 65, and and it was an early aggressive onset of idiopathic scoliosis. And yeah, it was a quick process. It was honestly a sit down with the surgeon saying, what options do we have? And for our situation, that angle, he said, there's really no other option but surgery, because when it crosses over about 60 degrees, it begins to compress on the lungs and their capacity to breathe, and gravity takes over at that point, to the point that it's a train that's going downhill. It's really hard to stop it. And so for us, it was this is the one option we need to look at some surgical options. And at the time, prior to the a couple months of us meeting with that surgeon, there was surgical options where they'd do this tethering, and they'd have to do the surgery every 6 months as the child aged, to be able to meet their growth and make sure the tethering was working, to try and correct the curvature as much as they could as they grew. We were lucky enough that there was a procedure called the magic rods that had been approved just a couple months prior in the state of Utah. In fact, a procedure had been done in Europe for a few years, but eventually got FDA approval, and then the insurance companies here in Utah approved it. But it was a tethering procedure for her that they anchored kind of down in the lumbar region, and they put almost these hooks that were hooked up onto her rib cage, and a few different spots up in her thoracic spine. And they were able to take in the surgery, correct her spine as much as they could. They got it to about 20 degrees. And then every about 2 to 3 months, we'd go back for a visit. They would do a whole series of x-rays. They were always looking at her bone growth to see where her growth plates were, and also to see how much she had grown. The big benefit of this is that they can do the corrective internal bracing essentially while they're growing, and so they're able to adjust it according to how much she grew. And they would do that by this external magnet mechanism that would turn a mechanism within her and then lengthen it to whatever growth that she had. And so that started the process of lengthening and trying to manage the curve as she grew until she was about age 14.
14. When did it start? When did you have the first surgery?
First surgery was 11. 11,
and then at 14 was the final fusion procedure?
Yeah.
So that's a lot of years of going through that. That's tough.
Yeah, it was... it kind of becomes part of your life, and it's the surgery for the magic was tough. The fusion was harder. Obviously, you're a lot more bone, not more soft tissue, but
sure,
pretty life changing to some degree. So.
Yeah. That's a tough thing to go through. We had the other option presented to us. My daughter's curve was about 40 degrees. So certainly in the range to treat, but not too far to where surgery was the option like you experienced. So bracing is what was recommended for us. So my daughter was fit for a Chanel brace, which is a custom fit orthoplast material. It's quite the process. I was surprised at how much goes into the custom fitting of that brace. It is matched to fit every angle, and they have specific pressure points, because you imagine you're trying to lift a shoulder, rotate the thoracic spine, put pressure on the opposite hip. So this brace is quite unique and fit to her very specifically. And she was recommended that she's at a riser grade 0, which is measuring skeletal maturity, how much growth potential, or how much are we expecting this person to keep growing. And she was at the low end of that spectrum at a 0, so she's expected to keep growing for probably another 2 years, until she hits about age 14, I think is about the age. So we were told that we can plan on the brace, and it's going to be a full-time use brace, so 18 hours a day is the goal, and probably for about the next 2 years she'll be wearing that.
Wow.
Yeah, and it's been a good experience so far. I'm impressed that she's taken it on, and she's being really good with it and trying her best. But a 12-year-old that's just starting into junior high, there's a lot of social implications there that we've had to fight a little bit. So that's I think probably the two mainstays of the treatment options.
Yeah, that's when you did research, you looked at all the options. I mean, in our discussion today, we talked about the Schroth method. I don't know. I've just witnessed some things. I don't know the specific specifics of that, but what have you seen on concerning the Schroth method or anything other than bracing or surgery?
Yeah, it's looked at in the literature at least to be a fairly helpful and useful tool as an additive treatment modality. I didn't see that there's a lot of strong evidence to say that that's superior to bracing or surgery, or that as a standalone treatment could match the use of the combined therapies of a brace and the therapy. But the brace or the therapy is thought to be definitely a helpful or useful additive treatment, which just makes sense. That if somebody's going to be rigid and braced, or somebody's going to go through a surgery like that, I think the benefits of what you guys can offer in the therapy world is just obvious. We want to keep people active and healthy and moving.
Yeah, and I think there's some great benefit in terms of as adjunct, as adding to if you do bracing or whatever it may be.
Right.
I don't see as many in those more aggressive curves, but we'll have routine individuals will come in, and it's always funny. They'll say, I have scoliosis, I have an 8-degree.
Yeah.
And I always like, okay.
Yeah.
Under 10 degrees, pretty normal.
Yeah. Yeah.
But I think that in their mind, they think that's the root of all my problems. But offering just some things to be able to work on it and address it, just like all things, I think is very powerful. And so I think the Schroth is a good option if there is a more dynamic curve, and to be able to add as adjunct to be able to keep moving and keep physically functioning.
Yeah, so. I agree. Well, I appreciate you sharing your knowledge and expertise, and good luck with the rest of your journey. And
well, you too.
Appreciate it.
My daughter's she's 21 now. You're just in the heat of it.
Yeah, that's true. Yeah, you're kind of the tail on us. We're in the thick of it now.
Yeah,
so
good luck.
Appreciate it. Thanks.
You bet.